So Dr. Sudhir is going to talk about axial stability assessment of Clareon IOLs in short and long eyes post-cataract surgery.
Good evening, everyone. I'll be talking about axial stability assessment of Clareon IOLs in short and long eyes post-cataract surgery. No financial disclosures. Clareon monofocal IOL is the next generation hydrophobic aspheric IOL, and the post-marketing studies done in India and abroad has shown an excellent visual outcomes, no surface A's or glistenings, and less of yak capsulotomy rates. And IOL stability was confirmed as a safety endpoint in all these studies. And similar results were seen in the 3-year follow-up study, but all these were done in eyes with a normal range, which is 21 to 26. No extremes were enrolled. So the unmet need was we wanted to look into how these IOLs perform in extremes of axial length less than 22.5 and greater than 24.5, and scientific rationale is axial stability is crucial for predictive refractive outcomes, and deviation in IOL position can result in suboptimal outcomes and increased cost. And Clareon IOL is based on Alcon Sacrisoft IQ IOL design and is expected to maintain same stability across various bag sizes due to its advanced biomaterial. So the study involved enrollment of patients who are in the axial length less than 22.5 and greater than 24.5, and with a preoperative astigmatism less than 1 diopter. So all these patients have a routine examination. Apart from that, they had an optical biometry using IOL master at multiple intervals like 1 week, 1 month, and 3 months postoperatively. And this included 30 eyes in both the groups and was done by a single surgeon using a IOL power calculation using a Barrett Universal 2 calculator. These were the assessment schedules which were done at various visits. So the anterior chamber length measurements was done at 1 week, 1 month, and 3 months, whereas the visual refraction was done at 1 month and 4 weeks. So these were the results which showed that we had in the short eyes the range of axial length was between 21 to 22.5, and whereas in long eyes it was from 24.54 to almost 31, uh, uh, 31.01. So we measured the anterior chamber depth at 1 week. In case of short eyes, it was 4.30, and which was almost same, and it increased by little at 4 weeks and 12 weeks, but remained stable. Whereas in long eyes, the axial length was slightly reduced and then maintained at 1 week and so at 4 weeks and 12 weeks. So the differences were not significant, except for in the long eyes at 1 week, and comparing with the 4 weeks, there was a slight reduction that could be explained because of retained visco which could have got absorbed, and then it maintained the axial stability. So we also looked at the refraction changes at 4 weeks and 12 weeks. It was stable and there was no change in the refraction, and the spherical equivalent was also well achieved with in all these IOLs. So the axial stability of Clareon IOL was evaluated using serial anterior chamber depth measurements, refractive error assessment, and visual acuity, and there was no statistically significant difference was observed in ACD measurements over a 12-week follow-up period. Stable refraction was noted during 1 month and 3 months follow-up visits. The previous study had compared between Alcon IQ lens versus Clareon IOL. They had found there was a difference in the anterior chamber depth at 1 week to 6 months, but the measurement should be done at least 1 month so that the stability can be checked. So in our study, at 1 month and 3 months, it was stable. To conclude, that study findings suggest that Clareon IOL demonstrate favorable axial stability in all eyes and extremes of axial length, and this implies that ophthalmic surgeons can confidently consider Clareon IOLs for patients with varying axial lengths, ensuring reliable postoperative outcomes and potentially improved visual results. Thank you.
Any study done with the toric Clareon also?
This was done just before the toric was introduced in the Clareon platform.
Okay. All right.
So that's why we had to use.
This was your limitation.
Yeah.
All right.
Thank you.
Thank you.